Welcome back, everybody. Episode 58 coming at you with Dr. Tom Psarras. You guys are going to love this episode. But before jumping into it, a couple housekeeping items. I want to give a shout out to our crew out in North Battleford, Saskatchewan. You know we love you. Thank you for all the support. Completely made that up. Second, August 9th, our big event, Virtual Summit, Low Carb and Ketogenic Approaches to Health. Like we said, we're trying to change the boogie, change the narrative. What can people do to take the power back, reduce their risk of getting ill from COVID-19? And so we're doing this event, 3:30 Eastern, $20 for the basic package, $50 for the premium, which gives you continuing medical education credits. It gives you audio, video recordings. It gives you transcriptions of the event. So it's a deal, it's a steal, and it's us trying to change the boogie. And so, yeah, jump on that. There's links to that in the show notes. All right, let me tell you about my guest, Tom Psarras. He and I go back years, and we currently work together at the Montfort Hospital in the intensive care unit. And the reason I wanted to bring this show to you is, as frontline staff, we saw what obesity, poor metabolic health can do to our COVID patients. We saw that young people were more at risk despite being young of age, but having that bad metabolic profile. And, Tom saw what was going on, and he took control of the situation for himself. He lost 30 pounds, and you'll hear his story through a mix of food selection, through intermittent fasting. And to me, it wasn't so much how he did it. It was the fact that he did it. The fact that he wanted to be the change, show other people what it took, show that he took it seriously, and be an example not only for the rest of us healthcare providers, but also for our patients. And so it's so beautiful. So I hope you enjoyed this conversation. We also talk about what it was like being what it's currently like being on front lines with COVID and amongst our colleagues and other allied health professionals. And it was a really deep conversation. And so without further ado, my boy, Tom Psarras. Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients, and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Ladies and gentlemen, I am stoked for so many reasons because I got one of my colleagues and good friends, Tom Psarras, on the show, and he inspired me. Like, he wasn't on the radar to be on the show, but his story inspired me to get the word out because he's changing the boogie. He's taking his health and taking things that he can control and being an example for so many of us. So welcome to the Quadcast, my friend.
If this is the way to get on, that's good. That's not too hard. I'm very low on the totem pole, so this is good.
I love it. So, my friend, where do we start? Like, maybe we should start with some of your story. So, you've lost, how much have you lost now?
About 33 pounds as of, this week.
I love it. And let's just start straight up. What inspired you, or what's the reason why you start to push towards this weight loss?
So, a lot of people want to lose weight, obviously for health reasons, right? And then I guess we've seen a lot of patients, right? And each one has their own little kind of story or something that motivates them. And so, I'm 45 years old, 44 at the time. I remember COVID was kind of hitting the airways kind of around January, February, right? Mm. And we didn't know a heck of a whole lot about it, right? So a lot of us were just kind of, I've heard with your podcast before, a lot of us were kind of like, the unknown is scarier than the known, right? And then what ended up happening is early on, we started to hear some news about, we were all kind of a little bit spooked by it. And we heard news about a little bit early on about how, especially in young people, obesity was an issue, right? Just anecdotally. at first. And then obviously there's been a ton of research since. So I think whether rightly or wrongly, that was my initial kind of spark plug. And then what ended up happening was I just kind of said, all right, you know what? I've been living kind of this fast-paced lifestyle in the hospital, basically, just working, being a dad. I have 3 kids, driving to hockey practice, driving to, softball practice and baseball and stuff like that. And then at the end of the day, I just kind of said, okay, wait a second. There's certain things I cannot control, but there are certain things that I can control. And then there's just empowerment to just say, if you have enough of a reason, you just look around and you just see your kids and a whole bunch of things. And I understand the risk profile. I'm low risk, but at the same token, I thought, okay, this is a good opportunity to kind of take my health and switch it up a gear. That was the main driver. And then there's secondary drivers, obviously.
Absolutely. And let me echo too, buddy, like how fearful things were with the unknowns, like when I mean, this is the thing, like we saw, like you and I had many a conversation, like we saw, patients, like not giving up too much information here, but our age, that got sick and really sick. Yeah. And it was clear though, that they had risk factors that we talked about, whether obesity, whether it's hypertensive, whether it's type 2 diabetes, but still, like when it's somebody that, is roughly your age, that can be quite intimidating.
Well, and we've talked about it to a certain extent, right? Like, I mean, it's amazing as ICU docs, right? Like we need this veneer of kind of like impenetrability, so to speak, right? Or else we can't do our job, right? You can't go into every single, environment and you can empathize, right? Mm-hmm. But if it breaks you down every single time that you walk into a room, you lose objectivity, you lose effectiveness, right? Mm-hmm. But there's no question, we can see, you pick the disease, 100 of them in the ICU, but then when one of your colleagues has the same thing, where anything breaks down that psychological barrier that you put up. And when we saw that, I mean, I saw that with H1N1, unfortunately, that also, that had a significant effect on people. At that time, I was in my 30s and I saw, a few, definitely people intubated in that age group. And I think when we first see some people our age, right, it kind of hits home a little bit, right? It's kind of like, whoa, and our brains aren't wired for statistics, right? Mm-hmm. Our brains are wired for like anecdotes and stories. And so we look at that and then all of a sudden we go, oh, wait a second. And it kind of feel that knot in your stomach a little bit more or a lot more, I should say, than a lot of the other patients you really care about because you relate on a deep personal level.
Yeah, no, exactly. And just to, I was still training during H1N1. And the one thing I would say that was more, I was a lot more fearful of H1N1 than I am of COVID-19. And because it seemed a lot more random, in my opinion. Like when you saw someone in their mid-20s on extreme versions of life support on ECMO, that's crazy. When you see some guy that's perfectly healthy die from H1N1, like your mind gets blown, and once again, we're going to see those cases with COVID-19 as well. But I think once again, there would seem to be a little bit more of a predictability in this virus.
No question. This is different, but there is a predictability. I was looking at, I worked through H1N1 and I actually contracted H1N1
amongst other diseases.
Yeah, exactly.
No one's recording. No one.
What? All of a sudden, public health is calling me.
They walk through the door.
My phone just rang 3 times. Public health.
That's the app.
No. I was married and happily. Julie's upstairs at work right now. So here's the thing. The reality is that, I think it was from an intubation actually, because we've come a long way. I remember the time, and I hope I'm not mistaken, through just memory, but I remember the time going through my fellowship and being in ICU and treating patients with atypical pneumonias and not running viral like PCR on them. And literally just kind of going, I remember that day and just kind of going, okay, well, bacteria, antibacterials aren't working. And I think the H1N1 brought the whole concept of a non-bacterial pneumonia. Mm-hmm. And so we weren't as prepared, right? Like I remember intubating somebody with like definitely not the same. With H1N1, it was somebody who I think had come down from the ward. I was locuming somewhere and then just kind of crashing. And, my instinct was to protect them before myself. And, 3 or 4 days later, I'm driving home with muscle aches. And, 2 days after that, I can't even open up a jam, bottle because I've got so much myalgias. But, it was fine. We got over that. But this one definitely has a different flavor societally, right?
Yeah.
But I do echo what you're saying. There's no question. Like seeing, there's different age groups and different demographics. Like I remember the thing for me was pregnancy in H1N1.
Oh yeah, I totally
I
forgot about that. That was so scary.
And we're not seeing.
I forgot about that. Yeah, maybe I took that out of my mind grips because of just how PTSD that driving.
Oh my God!
Was.
Yeah,
that was. We did see some pretty scary cases with pregnant females. But wow, I mean, so it comes back to, yes, there's a predictability, more of a predictability. And it also said, we got to talking about controlling what you can control. So you decided this was enough of a push amongst other things to start losing weight. And maybe we could talk about how you did it, because I also want to talk about what we should be pushing to the public as well. But let's start with your story. Like, what did you use or methods you used to achieve your goals?
A mask.
Done.
And sorry, drop your mic now. Okay, no. So yeah, no. Quite honestly, so what did I do? So I think a little primer here. I think that each one of us uses, food as a crutch to some extent in a different way, right? Mm. When I have like night calls and when I have, particularly, challenging days in the ICU, I come home and it's almost kind of like I've earned my debt and can start, eating a dinner and then eating another dinner and then a kind of half dinner right before I went to bed, right? Mm. So I think there's a huge psychological component, right? And I think for the most part, a lot of people kind of like pick a diet or pick an approach, right? I think my take is I had to look at what was important for me and what I thought my weaknesses were with regards to food. Like I know it sounds kind of corny, but my relationship with food, right? Mm-hmm. And what I came up with was after dinner was, rather than occupy myself with exercise or other things, like, I hang out with my children a lot and stuff like that. But I always had this period of weakness right before bed where I must have eaten every day like 800 or 1500 calories, just like another meal, right? Mm-hmm. And then slowly that kind of added on. So what I decided to do was basically just a little bit of everything. But one of the things, no question, I kind of gotten back to kind of a little bit more evolutionary times where we didn't have a fridge at our disposals in a pantry, right? Like anytime, like it's almost kind of like every time you have a small weakness and you want to comfort yourself, there's a fridge right there. You can, like that, we didn't have to do that. You didn't have the option of doing that, hundreds of years ago, right? Like, so I think that to me anyways, if we look at it psychologically, that's the key. And so, with whole intermittent fasting, I don't particularly claim to kind of do this 16-hour and 8 hours like perfectly, or I don't kind of espouse any particular kind of 100%. I take a little bit of everything, right? It's a more of a nuanced approach. And so I try to stop eating after dinner, and I'm probably 80% successful at that. And that's what's made the huge difference. So if I eat dinner at 6 o'clock and what have you, then I won't eat again until, when I wake up and, 6:30, get ready for work. I'll probably eat around 7:15. So, that gives my body 13 hours, 14 hours of kind of, I guess you could call it intermittent fasting. Whereas before, it was literally the minute before my head hit the pillow, I was snacking on something. And then the minute I got up after my shower, I was snacking, I was eating breakfast, And so I think that I actually had a lot to do with it. At first, it felt a little bit uncomfortable, maybe for the first 2 weeks. And then I don't know what happens metabolically to you. I'm not, I do have a biochem and a psychology degree, but but I don't remember the Krebs cycle and all that stuff to any extent to give you an educated answer, but it just became easy.
Mm-hmm.
I don't know if a lot of people that it just and sometimes, on the weekends, I'll push it to, 16 hours and I have absolutely no problem. It's not like I'm starving, and it's not like in fact, I'm eating probably 8 or 10 servings of fruits and vegetables and, low glycemic index foods. And I also eat, fish, meat. I mean, my metabolic profile, so to speak, or what goes in my body right now is a lot better than 6 months ago for sure.
Yeah, I mean, I think you bring up a lot of really good points. So one is, I want to fully bring up or commend, like, there should be a not one size fits all. Like, it should be nuance to that individual, right? So what will work for you? And like, I'm a big believer of Pareto's 80-20 principle, like what's going to give you the biggest bang for your buck. And I think you were analytical with this. Like, you told yourself, like, you eat a lot after supper. And, whether, I mean, we could go into the theories on the timing of what you eat, like later in the night, whether that has some impact on weight loss or your metabolic profile. But I think the key thing, though, is knowing that eating later in the day or snacking, what have you, was something that could, with adjustment, could have some positive impact, right?
Yeah.
And so, and then, I'm a big fan of intermittent fasting for people because I think it's sustainable. Whether you do 12 hours, whether you do 14, whether you do 16, like whatever. The point is that you're restricting the time that you're eating, which I think automatically limits your calories, limits the amount of snacking you do. But, there's also a lot of components on what you're eating. Are you eating a lot of processed food, refined carbs, and all these things? But the key thing, though, what I liked what you're saying is, like, you've kind of found what was your kryptonite.
Yeah.
And adjusted it accordingly. And you're continuing to get results from it. I guess I really wanted to commend you for, taking the power back, and also letting people know, like, part of the reason I want you on the show too is, like, should we be preaching this more? Like,
yes.
You know what I mean? Like, why aren't we selling the Kool-Aid or whatever the expression is, or the pudding pops, or isn't this crazy?
Okay. So, both you and I have had a lot of experience taking care of, unfortunately, the sickest patients who've unfortunately developed COVID. Okay. Who contract COVID. And so we don't have a flavor of, I think, perhaps the hospitalized patients who do well and so forth, and those patients who are minimally symptomatic or at home. But there's no question, anecdotally, right away, right? We saw, I remember reading an article on, and there's more than anecdote to this. Obviously, now there's been cohorts, and I don't remember the exact odds ratios, but they're significant. It seems as though, anecdotally, right off the bat, people noticed that there was a certain metabolic profile, and obesity was a very significant component of younger people who were getting more severe disease. And I don't know if you agree with that, but there definitely is, from what I've seen. So, and that may not bear out with, like, higher age groups, because, different statistics take over there, but definitely with younger age groups. So what I would say with that is, the public messaging, I think, has been great, but I think we're in a society where people look at pharmaceutical corrections to a lot of different things, which are 100%. I mean, that's how we cure a lot of people with a lot of diseases. But I think what this has taught us, and it's kind of an odd, like, if you actually look at this virus from a sociological or, perspective, it basically tries to take advantage of any kind of abnormality in your armor. You know what I mean? Like, it's almost kind of like, and when I mean abnormality, I mean it as like something, for example, like, if the normative thing is to have a BMI of 25, for example, and you have a BMI like I had of 33, okay, it takes advantage of that, right? If you have a frailty index that's higher as an elderly individual, it takes advantage of that. If you have diabetes that's not well controlled, type 2 diabetes that's not well controlled, or hypertension that's been long lasting for a long period of time, and we can get into, concentric left ventricular hypertrophy and yada, yada, yada from that. But just to stick to the most important stuff, it'll take advantage of that. Whereas you said with H1N1, yes, it's true that, flus take advantage of people in the context of any metabolic weaknesses or any physiological weakness from that perspective. But I haven't seen it to this degree in anything else, like even sepsis. I haven't seen it to this degree. Mm-hmm. And so then my answer would be, well, what are we waiting for? So if you look at the major predictors of severe disease, you look at, okay, so let's go through them. So hypertension, cardiovascular disease, you can include stroke or, vascular disease in there. Type 2 diabetes, which CDC is a high risk, and CDC kind of says, well, type 1 diabetes is a moderate risk, but things that you can control, type 2 diabetes, hypertension, obesity, right? And there's no question that many people believe obesity is a high risk factor. So a lot of people walking out there who are, 35, 45, who think they're, completely immune to this, but have a BMI of 35. And what's become normative for us is to walk around in certain societies and look at BMIs of 33 and 35 and think that that's normative because probably 30 to 40% of our population have a BMI above 30, right? So what I would say is instead of waiting for a vaccine, and which I'm not a pessimist about that, but other than waiting for remdesivir, other than waiting for, a dexamethasone and things like that, that we use in those patients that need it, I would just say, just think about what you can prevent. It's almost kind of like the lung cancer analogy with regards to smoking, right? Mm-hmm. It's not like we don't have the data. We didn't know anything come March, right? We had no idea, but we're in a completely different place right now, right? Like we know, like you said, you can't prevent. Look, if a lightning hits you, right? Like if, I'm not going to worry about this every single day of my life, but that's not my approach to this. But we work with it every day. But it's more about if you know that hypertension, obesity, poor metabolic profile with regards to type 2 diabetes, and we can get into more of that because I've actually seen people who their HbA1cs are normalish or pre-diabetic, and all of a sudden, as soon as I start treating them with COVID, their sugars are like 18, right? I don't see that with sepsis. I don't see that, not to that degree, right? And so I'm starting to read up about that too. There's something about being metabolically unhealthy that the virus likes and makes it harder. So if you can decrease what's the best way to decrease your hypertension naturally? Obviously there's many people who require medications, of course, but anybody will tell you, you lose 30 or 40 pounds, your blood pressure in most circumstances will come down, right?
Right.
Your ability to control your glucose intolerance will come down, no question, for most people. And again, I'm talking about the average, person I'm not talking about outliers So you're taking care of like 4 different kind of risk factors by doing one thing, which is kind of eating healthy, right? Which I respect is hard, but we got to start asking, like, why is the U.S.? I'll give you an example. Why is U.S.? Why is Texas? Yes, it's a public health thing, right?
Yeah.
But if you compare, again, anecdotes, and there's some studies now that are looking at things. If you compare the metabolic profile of some Scandinavian countries,
exactly,
European countries, and then you compare them to, unfortunately, our friends in the U.S., where there's no question. 42% of the population has an obesity profile. Mm-hmm. That affects your outcomes. I can guarantee you there's going to be more people per capita dying with COVID less than 30 years old or less than 40 in the US than in Sweden.
Exactly.
Like, per capita.
But this is what's driving me absolutely nuts. It's like, it's not even being talked about anymore. Like,
not at all.
At all. Like, we get caught up in the mass, we get caught up in schools, and all this stuff's important. Don't get me wrong.
Course.
But honestly, if you could have a reasonable segment of the population that you could avoid getting sick from this, potentially by getting them healthier, and like even if it reduces their risk by a small amount, getting fitter, getting healthier has other positive outcomes outside of COVID.
Huge.
Like we have seen the extremely obese patients come up to our ICUs after operations, and I don't need to tell you how many complications we see as a result
wound
of
problems and respiratory healing, ventilator associated
coming off the ventilator is more risky. Like a lot of benefits if we could encourage people to get fitter. And the other thing that's been blowing my mind, Tom, and I don't know how much you read about this stuff, but a lot of these approaches, whether it's low carb, whether it's fasting, whether it's keto, all these kind of things, you could get fairly rapid results. Like,
oh, absolutely.
People that go on low carb could get, some of them will be off their antihypertensives in weeks, which is, I mean, you and I, we went med school, all this stuff. I've never heard this. I'm 42 years old. I'm hearing about this now. Do you know what I'm saying?
Yeah, no, I mean, I think it's the approach. I think teaching approaches have changed, no question, from the time that I went to med school. And I know the medical students that challenge me on rounds are a lot more adept at speaking about this than I am, probably for sure right now. But there's no question, like, from a public health message, right? Like, think about where our numbers are right now. They're so low. Let's say we have a second wave, and, that's a different topic for a different day. But, we're going to be stuck with this virus for another year and a half. Maybe I suspect it'll become endemic, but it won't have the same societal impact as it does now, obviously, at some point. But there's no question that if you just look at it with blinders on just for this virus, if you were to say, well, what can I do other than, practicing good public hygiene, right? Like, 6 feet and everything that we tried and do. There is an inevitability sometimes that sometimes you'll catch it because of, one thing or another. Your kid catches it somewhere, you catch it because you live with them or whatever. Mm-hmm. There is no question, correct me if you think I'm wrong with this, that not having hypertension, not being obese, obese, I mean BMI above 30, and having a controlled diabetes, or even getting your HbA1c to, lower than 6.5, and guess what? Not being quote unquote diabetic anymore, or meeting that profile anymore. There's no question that has a morbidity and likely, well, for sure, mortality benefit as a population, right? Again, I'm not an expert at that. We've known this for lung cancer. We've known this for a whole bunch of things, but nothing has grabbed the attention of the public like COVID has in my lifetime, right? And so I think this is a time. I was looking at another study the other day where the effects of, I don't know if it was back maybe 10, 15 years ago, and they looked at, in Canada, the number of people that died every year because of obesity-related complications, like directly, right? And it was huge. Like, it's more than COVID this year by far. But of course, that's because we didn't let it run rampant through our population. I get that. So I'm not trying to compare something like COVID to other things, but I think we have to kind of wake up a little bit as a society to our eating patterns and obesity. So I'll give you an example, right? So think about the lockdown analogy, right? Which I agreed with, okay? Initially, right? Because it was kind of like we were kind of like,
what was going on.
We didn't know what was going on. So it's kind of like somebody at war, and you're getting shot at from all over the place, and you bunker. Yeah. And you just kind of, you regroup and you say, okay, what can we find out about these people that are, whatever. So it's like, okay. So if you look at that analogy, it's very interesting that we've known about the causes of obesity, right? For like eons.
Yeah.
Right? And even if it cost like lives and lives and lives and shattered families, and in so many respects, our approach was never, okay, let's go and shut down restaurants and whatever, right? It's an interesting, right? Because people have just come to accept it. Right? We've come to accept, if you were put into a time capsule and you went back to the 1970s and you saw me 6 months ago, you would think, wow, like this gentleman is likely not healthy. Mm-hmm. But if you put me 6 months ago into our society right now, it would be kind of acceptable, right? Yeah. So we've become complacent to it and just accepted it, right? Mm-hmm. It's okay to just have a beer gut. Mm-hmm. But actually, you know what? Like, we've seen a lot of people get hurt by that, through heart attacks, through MIs, through cardiovascular disease. And so anyways, this is broader than COVID, obviously. And I haven't won this personal battle. I've only been 6 months into it and so far winning it. Mm-hmm. But we'll see where it goes from there. But yeah, you're right. I think there's a huge public message to put out there.
Yeah. And there's a lot, even in your personal story, there's a lot of components to what you could emphasize. Like I still, like, we're talking about nutrition, diet, and different approaches. I also am a big, believer of fitness, exercise, like,
Sure.
just, something as simple as after your supper, family go to a family walk with the dog, get the blood flowing, like just simple things, right? Like, but I do realize that could appear to be a daunting task for public health. There's also like the part that I haven't talked much about is, and you alluded to it, like the behavioral science part, like the relationship with food with a lot of people. That's not in my wheelhouse at all. I don't even know what to say about that. But I think, empowering people, knowing, someone like yourself, a physician that saw what was going on, he was able to do it. Other people that were in similar situations were able to do it. More testimonials, because as you mentioned, people don't really care and think about evidence. They want to see the story. They want to.
Yeah. Well, look at one of the biggest examples is Boris Johnson, right? So the UK. Yeah. Well, so when he came out of hospital, whether or not it was his ICU physician, he said, that's what he said on media, that he weighed a certain amount of stones, which I have
15. I think it's 15 pounds or 15 kilos per stone. I think it's something like that.
But he was a certain number of stones, and then he said his BMI was 36. So this is Boris Johnson actually saying this. And he came out from that, and the story goes, at least the way I've read it in media, it was that his ICU physician actually spoke to him and said, he thinks that one of the reasons he got that bad was his obesity. Mm-hmm. And, you don't look at somebody, I'll be very honest, you don't look at somebody like Boris Johnson and say, at least I don't, and say, wow, this guy's metabolically unhealthy from just from looking at, TV pictures and conferences and videos and things like that. But there's no question. I think he realized it, and whatever you think of, the way he's doing his job and so forth is aside from the story. I think he, there's one example of that. And again, these are just one example, right? For me, I have to be honest with you. One of the things was my daughter started telling me, you snore loud. And I was just like, I've never snored. But, quite seriously, like she said, Daddy, you snore. And my wife said, yeah, you know what? I've never known you to snore. And then, and there was 2 incidents where I got kind of spooked out. And that was probably maybe a year ago. And that was, I was lying in bed, and I still remember. And I woke up kind of with like food, like a GERD basically. And it actually had gotten to the point where I actually probably aspirated a little bit. Right. And I started coughing, and I was just like, whoa. Like, I know I'm in my 40s now, and, call's not as easy and stuff like that, but that shouldn't happen. Right. Like, and so maybe other people, I don't know. Maybe other people would be kind of like, whatever, that's nothing. But that like scared me. Mm-hmm. So, I said, I got to change this. And I don't snore anymore. Like my wife says, like, even when you come back from call, nothing, no snoring. I never have that GERD. Like GERD's gone. Right. I mean, like just power walking I do with my wife. And I mean, sometimes I power off 2 hours and listen to some music and talk to friends, get in touch with my parents, who are obviously isolating more than at this point in time. And so physical activity, all that kind of stuff. But, I've also seen a lot of people in my neighborhood where I live, like there's a lot more people walking. There's a lot more people so that's nice to see, right? I think people have reconnected with their families to a certain degree, some more than they had hoped to. I heard the divorce rate in Spain is like going through the roof now, but
I could imagine. I love you, mommy. But it's a good, like, certainly I'm definitely seeing more people out, and whether that's just because of being confined for so long or the value of fitness. But yeah, I mean, it's a great point to make too, man. Like when you lose that weight, when you get fitter, like everything gets better. You feel better physically, mentally, I'm sure, like less fog, more thinking more clearly, mood wise is impacted. Like there's just so much benefit of us and how they're,
Yeah, and there's a little bit of ego to it too, right? Like you got a little bit of strut to your step again.
Yeah, you got your swag.
My Greek swag.
Yeah, your Greek swag. But by the way,
back to my dancing days.
You should have seen, I saw this picture of, what was that picture of you when you were 18 or something?
I think I was 17. What are you talking?
The white shirt, like the Greek god. Like, what the hell, man? I'm like, I started to like put my hands on the screen when I saw that picture. I was like, oh,
yeah.
Psarras.
So, okay. Now that you're bringing this up, you want to talk about motivation? Okay, listen to this. This happened sometime in the last 3 years. This is what happened.
Okay.
Was I took over the ICU from you. Okay. I was taking care of this patient who had just been extubated, and her family was there, and her family member was probably, I would say, somewhere in their 30s, I'd have to guess. And I walked into the room, and the family member, she said, "You're not Dr. K?" And I go, no. And then she goes, too bad. And then I was like, I became this small, and I took care of the patient, and we kind of had a fun chat. And then she says to me, "Don't get me wrong." She goes, "Don't get me wrong. You know," she said a few things, "but you're no Dr. K." So I was on a personal mission to at least get to 50% like Dr. K. I might not have your pipes, but dare say my hair's a little bit, maybe.
Yeah. You'll take any win after that. You take all of it. Hairline.
Look, man, this is still haunted. I have dreams about that encounter.
I totally forgot about that. Oh my God.
Yeah. Can you imagine how I felt then? I was just like,
she was talking about the skills. Like,
yeah, I know.
Nothing to do with
nothing.
Prettiness. Oh my God, TP. Oh man. That's I totally forgot about that.
So that was an extra spark to lose weight.
Absolutely. And what do you think our role is, like, as clinicians? Like, do you think we should be verbalizing this? Like, I like that. I didn't know that about Boris Johnson's ICU doc. Like,
yeah, that's what Boris Johnson said. Yeah.
Yeah. Like, I mean, you know us, like, we're typically not all about the prevention side of things. Like, we're really, in general, medicine.
Our society is not a preventative society.
No, but even at our level, like in hospital, like, it's a lot. We don't talk much about it. We're rescuists. But do you see us? Like, I'm just, I'm always about taking the power back, not waiting for somebody else to take the lead on stuff. Like, I'm just questioning out loud, like, whether we should be more proactive and more vocal about some of these concerns. Like, or you think it's kind of like deaf ears kind of thing?
Well, it's not, I think everyone's struggling with their own kind of like, so this I can talk about I think this can go into this part of the conversation, go into some interesting places I think are important. So what is our role as physicians, right? Like, and I've struggled with this during COVID. Like, I've really, like, you've created I'm going to plug, you've created an incredible platform, and you've done an amazing amount of public education, basically, and used your skills, or perhaps any kind of like, I read some articles about how you and your family are dealing with this that are being public, which I think we've incorporated as a family too, and I've learned from you. So so props to you. Like,
thank you.
You've taken this part of what we do as physicians and taken it beyond the ICU and helped. I have to say, admittedly, I've struggled with where my role starts and where my role ends. And I know a lot of physicians have struggled with this when it comes to either masks. Let's get away from like obesity for a second, but it all relates. Mm-hmm. Whether it comes to our knowledge about masks, our knowledge of, like, within the hospital, for example, or our knowledge of, healthy public health behaviors, or looking at my Facebook and seeing like bubbles of 17,000 people. Yeah. I mean, I digress, but like, you know what I'm trying to say. I'm exaggerating to a point, but you're trying to find that fine line without, like, being a steward of medicine, trying to give your input on things, and then not sounding like an arrogant whatever.
Yeah.
Because you definitely don't want to come across like that. And there's no question I've come across like that to some friends in the last 4 months. And I struggle with that because, I think that the happiest I've been throughout this process as a physician has been when I just concentrated. I'll be very honest with you. When I just concentrated on my ICU work.
Oh, amen, brother.
And I let public health do their thing because first of all, I think public health and Dr. Vera Etches in Ottawa, I can't say enough great things about the way she's handled things here. I mean, that I don't know her personally, but I've
tried to get her on the show actually.
Really, yeah. But I plug like Ottawa Public Health like crazy because I think they've done such a good messaging job, and nobody's perfect, right? But I think they, under the circumstances, they were the first to implement a whole bunch of kind of policies, and I think they've turned the conversation from one of a complicated public health kind of thing to one more of safer socialization, much like when HIV came out, right? There was this whole push of abstinence. And then people kind of woke up and said, no, right?
Exactly.
You can't lock people up forever. But I think what Ottawa Public Health is doing is kind of saying, trying to get the message out indoors. Don't do it. Like to a certain degree, obviously. There's a nuance to that, obviously. But they've put out messages about how to safely socialize because we're humans. We need that. And so all of that to say, to get back to your initial question which is what is our role? I have to be honest. I have in the last month or two, I found myself when I was on Twitter, I found myself when I was on like talking to friends, just always focusing on, the 10 kids that I see playing basketball, like contact basketball down in the park, for example, right? Or the 30 people that kind of get together out at the park with obviously no social distancing or anything like that. And then as a physician, is it my role to like go in there and say, put my badge on, and I'm obviously joking, but, and say, clear up guys, this is going to lead to this. This is going to lead to this. And, I've kind of shut that part of myself down a little bit because I've just kind of said that's, I only have a certain amount of energy. And I think that for me as a physician, I go into work, as well as I do pretty much 1 and 2 ICU almost. And so when I go into the ICU, I do my ICU job, and there's no question I'm preachy by nature a little bit. But as I've gotten older, I've recognized my own faults, and I recognize that, the classic, I point one finger, there's 3 pointing right back at me. So I'm not perfect in this. And I also have to recognize the fact that I'm a healthier individual, happier individual when I do my job, which I think in all respects is hard enough, right?
Man.
Like we deal with stuff that is,
people have no idea. It's funny. That was the one thing about COVID that put a lens on what it's like to work in the ICU a little bit, and the stresses of ICU. Like, yes, COVID obviously brought another huge element to that, but our day to day, I think no one really still doesn't have a full appreciation of how crazy the stuff we deal with is.
And you know who else I had a lot like who I developed a ton of appreciation for. And I just got into this conversation. This is actually, I'm glad we got into this. So it's a 2-point thing that I want to mention. And one is a ton of appreciation for the nursing staff in the ICU, like a ton. You're talking like there are different risk profiles out there, right? And as a physician, we're not as intimately connected with our ICU patients, right? Like we do our rounds, we go around. But especially in March and April when we
12 hours,
like
12 hours at the bedside, man.
Yeah. And when I was having a bad day, I would look at some of my nursing colleagues and I would be like, there'd be people in their late 50s, early 60s. Like, and they know, like risk factor wise, it's very different than if you're 44.
Yeah.
And even our younger colleagues who are phenomenal, nobody knows, right? So they walk in there and it's like they had a smile on their face. Yes, there was anxiety at the first couple of weeks, right? But it seems more and more that they accepted their societal role and we accepted our societal role. And what I'm trying to say is that everybody in the healthcare field really came together, accepted our role in society. And instead of kind of saying, that's it, we're out, we're not doing this. All we really asked for was PPE and let's get to business. We have a we have a role to play. I even had this uncomfortable conversation with my daughter. I remember we were walking one day and she's 13 years old and she's smart enough to, and this was probably one of the most uncomfortable conversations I had with her. And I said, because at that time we didn't know age data and this, like we were just starting to get things from Italy and China and stuff like that. And I said to her, would you want daddy? I straight up, I still remember exactly where we were. We were just walking down the street about 200 meters from here. And it just clicked in my mind. I have to have this conversation with my daughter. And I said, would you want daddy, if there was a risk that daddy would get really sick or even die, would you want daddy to take that risk to help people, even if it meant the worst? Or would you want him to back off and whatever? And she thought about it for about 5 seconds, I think. And she said, and she looked at me and she kind of teared up a little bit, but she said, I would want you to do what's right for people. And, whether or not you get that motivation from that, or a lot of my nursing colleagues and a lot of the, the custodial staff at our hospital that are, like braver than, like in this scenario, more
all
than
of us. Yeah, 100%.
That's where I got my motivation from. Now we know a lot more. We know how to protect ourselves a lot more. We know that the risk is a lot less, given where the viral loads are and things like that. When that's a scientific topic. But I think that, as a society, we each have to, and this goes now onto another thing, which is teaching. And also, you're starting to see certain anxieties in different professions now that are going to be potentially exposed a lot more than in their normal day-to-day lives that they can protect themselves from to a certain degree, right? But I think the message in that also has to be, nothing's 100% safe, but we try to make it as safe as possible. But we each have our role to play in society, and we each have to try and live with this as best as we can, or else society doesn't function well. And this goes even to sports teams, by the way, right? When the NHL, we're talking about, like, I don't want to get too off topic, but I hope I'm not getting off topic here. But when the NHL was talking about bubbling and the NBA, we won't talk about the MLB because I think their approach is it's not anyways. But there's a societal role to that, like, most of those guys are in their 20s. They're in a bubble. Statistically, as well as I do that it's not going to be a big deal for most of these guys, right? And I mean that with respect. I'm not trying to say that this is not a dangerous virus. If anybody understands it's a dangerous virus, trust me, it's us. But they have a lot of protections, and we have to talk about statistics in that. And they provide a social good. The fact that I can be motivated at night to watch with my kids sport and get them interested and get my mind off whatever, that's important. So I guess what I'm trying to say is everybody has their role. Like, we're not, like, I see frontline heroes and stuff like that, but everybody has a role.
Yeah, but I couldn't help to well up though when we think about the nursing staff. We can't forget about the respiratory therapists.
Oh my God, the respiratory therapists are, oh my God, I have so much respect for them. And they know that.
Absolutely. But the fact that everyone was like, and
the PTs and OT, everybody.
Yeah, everybody. Like, and just to be clear to those listening, like, by far the majority of people were like, we are going to step up. We are going to do what our society needs now. Because whether we got societal props or not, this was going to happen. This was innate in people. And this was such a beautiful movement. And you're going to think I'm crazy, but I was looking forward to going to work after dealing with some of this stuff. I'm like, that sense of community, that sense of like camaraderie, like we were part of a team that was doing some amazing stuff and truly amazing stuff. But yeah, I just want to emphasize like that whole, like, that role. And, because we're getting into complicated times. As you mentioned, the sports, but also like the teachers right now, they're scared as hell. And what I want to say to any teachers listening now is that, we need you. This is, we had that fear, we had that anxiety, but with time, with exposure, with the idea of knowing that, the stuff that we're doing works to protect us. And even if we get exposed, there's safety measures in place, but ultimately society needs you. We need you. This is we need you. This is your time to be that frontline hero.
Exactly. And I think the next frontline heroes, so to speak, are going to be our teachers,
Yeah.
And I don't say that lightly. I mean, the best influences in my children's lives have been teachers, and I'm sending all of my children back to school.
Same here.
And I think there's we can do homeschooling and we can do private schooling, but we don't. That's our choice. And I know there's, this is a complicated topic because obviously there's a lot of anxiety with in the teaching profession, and rightly so to a certain degree. And I respect that because I felt that, right? And none of us are immune to potentially getting this at work, right? Mm-hmm. But I think we have to try and go to science as much as we can. I don't pretend to be an expert on, childhood transmissions because I think it's a smorgasbord of like different studies and things like that. But if we can keep our background community transmission level low, and, I have a friend who works in Texas and a very good friend of mine, actually one of my best friends, and that's a different consideration right now, right?
Yeah, we're not Texas.
We're not Texas, right? So I think in any discussion that we have to have, and if you want to get a good discussion, let me start talking about the Atlantic bubble. Bring it up. If we want to have a discussion about how to deal with COVID, we have to stop thinking about anecdotes. We have to start kind of looking at data. Right? And let epidemiologists discuss things, talk about things. And yes, when it comes to again, I don't speak for teachers and I don't speak for teachers, and coaches have been the absolute best influences in my children's lives. So I respect that. But I think, yes, of course, if there's a 65-year-old teacher who has, significant risk factors, absolutely. But I think, for the 35-year-old or 40-year-old teacher who's healthy otherwise, we have to put our risk and society's benefit amongst everything else. Because I have to remember, like, none of the nurses that I know, or the OTs or the PTs or the RTs, signed up for the army, right? Like, this wasn't something where you go into the hospital and say, you know what, there is a possibility that I may get seriously ill at work. Like, you do that when you sign up to be a cop, right? Police officer. You do that when you sign up for the army. There's an understanding there, right? But as a physician, I don't know about you, but nobody asked me in my medical school interviews, like, yeah, we have maybe certain exposures, Hep B, Hep C, HIV, those kind of things. But it's not like, it's not the feeling that we had in March, right?
I do think we signed up for it to a certain extent, especially being ICU. I think that was a bit of obviously not to this extent, but I think we all knew that there's going to be high risk respiratory illnesses. You and I, depending on when you're training, I'd go through Ebola, SARS. Yep. So I think it's part of the game, but not to the extent where you think, you legit, like what you're seeing in Italy and so forth. Like, I don't think none of us thought.
Well, we were scared. A lot of us were scared.
Level. Absolutely.
I don't know what we're going to do now. That's maybe another conversation that you're going to have through, and I've heard you speaking with Isaac and Suman about this with regards to teaching and things like that. But, they're our next frontline heroes, in my opinion, because I think that 100%. They're an integral part of our society. And I wish them the best to try to figure out what's comfortable in each of but there are so many good people on that front working. Yeah, as I said, I'll go back to it. Teachers, other than my wife and I, hopefully, as far as influence, teachers have been the number one influence on my children's lives.
100%.
And they need that. So I don't know. I wish them the best to try to figure this out, and I'll support them in any way I can. But again, I think that's a societal thing where we have to kind of try to figure it out, especially with our background activity right now, which is low.
Yeah. And I want to echo what Tom said. The teachers have been everything for our kids, and but they're the next heroes for real.
Absolutely,
buddy. Listen, Tom, I think this has been a spectacular quadcast. I don't know about you. We covered a lot, and a lot that I think people will find helpful, whether it's the value of weight loss, staying metabolically sound, how to be safe during COVID, getting our kids back to school, the rigors of our job. But this has been an absolute slice, my friend.
We always get into good conversations, you and I.
It's true.
Even if it's trying to get a muffin at the 20-minute lineup or the something.
Absolutely. And I love it because it's always solution based. But yeah, no, I totally agree, my friend. Thank you so much for doing this, and keep up the hustle, my friend.
Yeah, I know. Keep doing what you're doing. You're making a big difference in people's lives, Claude.
Thanks so much.
All right. Cheers, man.
Cheers. Quadcast Nation, tell me that wasn't tremendous. It's what we're talking about, changing the boogie, one step at a time. If you love the show, please leave comments at quadcast99@gmail.com. Follow us on Twitter, Instagram, YouTube at Quadcast. If we air this before August 9th, don't forget of our low-carb ketogenic conference that we're doing 3:30 August 30th Eastern Standard Time. It is sinister, and for those that are medical, you're getting continuing medical education credits. Leave a 5-star review and some love on iTunes or Spotify, wherever you listen. That helps with the visibility of the show. And once again, for us trying to change the boogie, we need the visibility, baby. Awesome. Thanks so much for listening. We're going to connect soon, and take care, guys.